We have come to an agreement on Medicaid expansion, and the agreement is that the Senate will modify the House's Medicaid expansion bill. We're in the process of doing that, so I don't have the draft at this point, but the new version will eliminate certificate of need for behavioral health beds, for chemical dependency beds. It will raise the replacement equipment threshold to $3 million and index that number to inflation. It will increase the threshold for diagnostic centers to $3 million and index that to inflation. It will eliminate a CON for MRIs in counties with a population of 125,000 or more. That provision will be effective 3 years from the first HASP payment. It will eliminate CON for ambulatory surgical centers in counties with a population above 125,000. That provision is effective 2 years from the first HASP payment for both multi-specialty and single-specialty ambulatory surgical centers. The surgical centers that are exempt from CON under the provision will be required to have a 4% charity care requirement for those centers in the counties with populations above 125,000. And there will be an annual reporting requirement regarding the charity care. HASP will become effective immediately upon enactment of the legislation. Medicaid expansion would be effective only upon passage of the 2023 budget. That is the agreement. From a timeline standpoint, we've got staff working on an amendment to the House bill that we will take up in the Senate. I do not know if that will be ready in the upcoming week or not, but we will move with all deliberate speed to move this forward. And with that, I'll turn it over to the Speaker, and then we'll take your questions.
Thank you, Senator Berger. Good morning. This is a process that has taken quite some time, but it has resulted in I would submit to you, a product that is going to do a lot for North Carolinians. Senator Berger did go through the terms that were reached through negotiations between the two chambers that have been happening now for some time. And at the end of the day, what we know is we're going to have a legislation, we're going to have a policy that is going to expand access to working North Carolinians, that is going to ensure that there is a more robust supply of a lot of these services, that is going to result in less cost, but at the same time, vitally important, to protect access to health care, particularly in our rural areas. One of the balances that we were always concerned about was ensuring that we don't do anything that creates greater disparities and greater access issues to health care in our rural parts of the state. We have so many communities and counties that are having declining populations. They're having aging populations where the needs are even more acute. And where those areas where they have truly declining populations, the ability for the local community to supplant or to provide for that is even more challenging. So this is, I would submit to you, a very balanced way to approach it. It's one that we've consulted with stakeholders from around the state, everyone from hospitals to other healthcare providers, to you name it, folks that we believe are experts and have varying points of view. And the result of that has been to come up with something that I believe is a very carefully crafted and appropriate balance for where we are in North Carolina. And really probably what has really gotten us to where we can get to this point, I would say, is probably the HASP. The fact that the HASP funds are going to be coming to these communities that are in many ways so much in need. So it really provides a stabilizing factor. The 90-10 match, of course, does as well. But those things have been game changers that have allowed us in a very fiscally prudent and fiscally responsible way to move forward with expansion and to move forward with CON reform. So with that, we appreciate you being here, and I guess we'll take questions at the appropriate time.
Yep. Michael? So the expansion is, for all practical purposes, a budgetary matter. We've got all sorts of provisions in our budget that deal with Medicaid payments. I mean, for instance, last year we extended traditional Medicaid to further postpartum care. Those folks, or many of those folks, would likely be eligible in the expansion population. So it just fits with doing that effective with the passage of the budget. I have not talked to the governor.
I haven't yet as well. We felt like it was important that we let our members know, let our health chairs know, because this has been a process, and go ahead and get the information out. But we'll be either meeting with or talking with the governor today as well.
Yeah, Gary.
Okay, so is there a date in which enrollment would begin under this bill?
Enrollment for
Medicaid expansion.
I mean, the bill that came over from the House has an effective date of January 1. We've not had any conversations about that aspect of the bill, but we're going to take the House bill, we're going to put these provisions in, and we'll work everything else out.
Yeah.
And a follow-up, we know you've been talking about this, but was there some breakthrough? Did this happen quickly today or yesterday? Because we talked to you folks earlier this week, and there seemed to still be a lot of uncertainty.
Well, we've been conversing, the Speaker and I personally, our offices, we've had conversations with our members. It's been a process that's been ongoing for the last, I'd say, 4 weeks or so.
Absolutely. Yeah, it's just when we've had our gaggles afterwards, and I've said we're working on a few other things, this was one of those things that we've been working on, but we're working on a lot of other great things as well.
Yes.
What changed between July and now? There was sort of a standoff, or not a standoff, that's not the right word, but stalling in July. What broke that loose now?
So I don't know if there's any one thing that broke things loose, but I mean, it was pretty clear that that it was going to take some time for us to really get folks comfortable with a lot of aspects of both expansion, the CON provisions, and some other things. I mean, there are still some things that need to be done, but this is our agreement, and I'm very comfortable with it. I think it's a good agreement for the state. It's something that respects the concerns that a lot of folks have had about various aspects of both expansion and HASP and the other provisions. So I think it's just a process. And I think you've heard me say multiple times that if you think about how far we've come over the past 12 months on this issue, I think this is just a continuation of those conversations.
And I was going to say on that too, you've also had a lot of discussion between the various stakeholders. I think folks have wanted to sit down and say, okay, if you do this, what does it practically amount to in terms of the financial sustainability of the model of healthcare? And I got to give a shout out to the health committee chairs in the Senate and in the House. I mean, these folks back here, while Senator Berger and I are dealing with a myriad of issues, these folks standing behind us have been working now for months, really drilling down on this issue and trying to find consensus. And so I just got to say, these are some of the most underpaid, overworked folks in state government back here. They've done an amazing job.
And have you guys talked to the caucuses about it? I assume you have, but do you have majority support in both caucuses?
So as for the House, we met with our health chairs. We knew coming out of the caucus the parameters of where we wanted to be and where we needed to be. So we haven't gone back and unveiled this to the full caucus just yet. We reached this deal late last night, but put the finishing touches on it this morning, and felt like we needed to go ahead and get it out there because there would always be speculation and rumor and all that kind of thing. Go ahead and just get it out there and get the details to the public, because this is something we can all be very proud of.
Can you explain more about why making this tied to the budget process, because it could still pass separately? Why is it as far as making sure that the budget passes, or earlier in the year, or just that timing, other than obviously there's money expected?
The primary reason from my perspective has to do with matching it up with other money provisions. And we generally, I mean, from time to time, we'll pass something that deals with spending outside of the budget, but it's usually a small one-time thing. This is a recurring situation as far as expansion is concerned. Will impact various parts of the budget, and it needs to be coordinated with the passage of an overall budget.
Because
What you all have already agreed going to be what the version is actually going to look like, or is there still some other negotiating going on about this specific?
don't know of any specific negotiations about anything. But obviously, we're talking about the high points. There's a lot of detail in, for instance, the 4% charity care. I mean, there's a lot of detail there as to how do you define charity care, those sorts of things. We've agreed on some language as far as that's concerned. So, I mean, I believe that if you take the House bill that came over to us and you add these things to it, that you've got 95% of what the final product is going to be.
I agree. I mean, we've dealt with the things that have generally been the barriers in the past, but I want to follow up on the answer that Senator Berger gave you on the budget. I mean, we're talking billions of dollars here, right? I mean, it really needs to be a part of the budget, and the schedule that I remember your look of surprise when I told you our schedule, right, that we would have a budget out of the House before the Easter
Almost
recess.
as surprised as I was.
Easter recess. And the Senators assured me they're going to pass exactly what we send them in the budget without changes. No.
Yeah, sure.
There you go. There you go.
You heard it.
There you go. No, but we're going to have the budget out in a very early period of time, and the Senate will have its schedule that it goes through. But I see no reason that we won't have a budget enacted, in June. And so that's the period. June 30th is the magical date for all of this. So I see no reason, that we don't get there. Things are moving well. I mean, if you look at the cooperation between the House and the Senate, it's probably the best this year it's been in a long time. I mean, think of the serious policy differences that have been addressed in relatively early. I mean, we're just now March. We've dealt with some pretty weighty issues that have kept this General Assembly and prior General Assemblies here until the fall of the year. So I'm feeling very positive about things.
Yeah.
Senator Berger, you left a lot of stuff on the table, including advanced nurse SAVE Act, basically, and a couple other things. Where do those stand? Are they going to be negotiated separately, if at all?
I continue to be supportive of the SAVE Act. There have been measures introduced in both the House and the Senate. We will continue to work to address the issue of supply, particularly supply for primary care needs. And the SAVE Act has provisions that does a great deal to help. I remain convinced that giving 600,000 people a card that says that their health care is going to be paid for is going to be somewhat problematic if we don't increase the supply of folks that can treat them. We've addressed part of that with the CON provisions. I remain committed to working towards the other part of it as well. It's not part of this deal. That's correct.
Obviously, we're talking a lot about the budget here. I assume we're still expecting the federal government's kind of extra payment at $1.8 billion. Is there any indication how that might get spent? If it's going to be specifically healthcare related or anything else?
Yeah, we'll deal with one thing at a time.
Yeah, we haven't fine-tuned that. My suspicion is it would be healthcare related, but in terms of how that's done, we haven't negotiated that yet.
It'll be budget related.
I agree with that. Well said.
Yes.
Have you guys agreed on a budget number, or do you have a projection of when that agreement might come?
Still working. Colin?
As far as the CON provisions, how closely does this resemble what was in the bill the Senate passed last year versus the compromise idea that the hospitals had floated, I think, sometime around September of last year? Where are we in that sort of spectrum?
It's hard for me to, without actually getting something on paper, I would say that this is probably somewhere between what the hospitals had suggested and what was in the Senate bill. But there's a lot of detail that you'd need to put them right next to each other to compare them. What I can say is I believe that this agreement represents the most significant modification of CON law in North Carolina since we began having certificate of need requirements, and it is a markedly positive step in the right direction, in my opinion.
One other question, with the sort of looming deadline, I forget exactly when it was, from the Medicaid rolls now that the COVID state of emergency is ended? Did that put any pressure on to get this deal out the door so that you're not taking these people off the Medicaid rolls and then putting them back on 6 months later?
I think that was part of it. Honestly, I think the most pressing issue has to do with the HASP payments, and I think that probably had as much to do with the rapidity with which we've been able to reach this agreement as anything. I'd have to ask one of our health folks.
Chairs may know the answer on that.
To say on that, what we've forecasted is a process that can begin on April 1st. The feds have prohibited any preliminary work from being done for those reevaluations, and we don't expect, even projections we've done with the department on how those individuals come off, almost 3/4 of them fall in the last quarter of the year. So I think those that would begin coming off would be a very limited number, and the populations are very different. This is a population that's on right now, had to have met one of the previous Medicaid qualifications before, versus there are now new qualifications under this bill, so there's not a tremendous amount of overlap between those two.
Donnie, you got anything on that as well?
Ralph said it well. There you go. Right on target.
Yes. Yes.
So you've had multiple talks with them about this in several months preceding. How do you expect that discussion to go today? Do you think they'll be receptive to this, open to it?
So here's what I would say. This agreement represents negotiations between the House and the Senate. The governor was not involved directly in those negotiations. The governor has been clearly involved in being an advocate for expansion. He's also been involved in talking to hospitals and others in an effort to assist us in getting to an agreement. But the negotiation was a House-Senate negotiation, and the agreement is a House-Senate agreement. I am confident that the governor will be pleased with this. My guess is the only thing that he would quibble about is he would want the Medicaid expansion provision to be effective immediately. And we'll have a conversation with him about that as well.
And echo 100% Senator Berger's remarks on that. And when I've spoken with the governor, he's been very clear. He likes the fact of what was passed, and he basically encouraging us to see if we can resolve the differences between the two chambers on the other issues. I don't think he's weighed in at all on any of that. He hasn't on our side, and clearly hasn't on your side as well.
Not in the negotiations.
Yeah.
That's
Yeah.
true.
I mean, for you all and the other lawmakers here, this has been going on for so long. So what is it, the fact that this is actually happening today, I guess this was yesterday that you all had the agreement, or at some point this morning. So what does this mean for, the relationship between the House and the Senate with the mansion and everything else? Since this has been 4 or 5 years.
We'll have to find something else to fight about.
Yeah, yeah. So you're now shocked twice in the same week, right? That was great though. But no, I think it just signals what really has been, what continues to be a very good working relationship between both myself and Senator Berger, and then all of our members between the two chambers. I mean, we have, but I will tell you this: we've had some disagreements on policy matters, but they've always been approached with honesty and integrity and candor, and folks lay out where they are on the issues. And that's why we've been able to get so much done. I mean, this is as we were going through the details of this, the thing that I was thinking about the whole time when Senator Berger was going through is what a huge announcement this is for North Carolina. What a huge policy direction this is, that's going to provide help for so many in this state, but it's going to do it in a way that is fiscally responsible. I mean, for years and years, we resisted expansion because we saw the prospects that the state's cost could easily triple, that it could be a runaway budget. When we all first came to power, one of the first things that we had to do was to rein in debt to the federal government and to rein in an absolutely broken Medicaid system that continued to have overrun, ever overrun. We had, nearly $1 billion one year. I mean, it was broken. Now it stays within budget. You now have an opportunity, now that you've managed that, to be able to find a way to responsibly expand that coverage because of these additional funds that are there. And at the end of the day, when you put a pen to the back of a napkin, it's a net break even at worst, a net positive, frankly, if you do the math on it. So it worked out well.
Last question.
How much money are you gonna get from the fed credits? Like how much money will
1.8 billion.
I think it's 1.5 billion, somewhere in that range is my
And
understanding.
then it's a recurring every year, I think 800 million. I mean, it's staggering numbers, and it's a net positive.
Yeah, and as the federal government is concerned, it is not tied to any particular part of the state budget. That's just additional dollars that come into the state.
Yep.
Thank y'all for being here.
Appreciate you.
Good job.
Thanks, y'all.
Y'all coffee?
Yeah, absolutely. I'm the only one who's on both sides of this. That's right. I know.
Good job. Thank you so much.
Thanks, y'all. Thank you, sir. Thank you.
You were amazing help. You really were.
Well, say,
You got me over. Yep.